Well, we talk a lot about pain management for adults and older adults, but we don't really touch on that area that much for children's, teens, and young adults. So thankfully today I'm at Akron Children's Hospital and I'm joined by Dr. Bala to have this conversation. Thank you for joining me.
Thanks for having me.
So this is pretty unique, some of the techniques that you offer here at Akron Children's. So can you talk a little bit about them?
Yeah, we're really fortunate. We've got team members who are experts in pediatric and adolescent pain medicine. So some of the techniques that we can provide our patients when they come in for acute pain, let's say pain after surgery or pain that started more recently, for chronic pain, so patients who have pain for 6 months plus, or even transitional pain, which is between that acute and chronic stage. We have experts and methodologies that we can really help to reduce that pain and reduce medications that patients may be on. One example is our ketamine infusions. And so ketamine has been shown in a lot of literature in the past 5 years to help to reduce chronic and complex pain, and even acute pain, and certainly the adult population, and there's more literature coming out for the teen and adolescent population. So I'd say we're one of the few centers who are providing ketamine infusions for our pediatric and adolescent patients. We're helping patients wean off of opioids if they've been on long-term opioids for chronic abdominal pain, back pain, headache pain, etc. It's been really a blessing for our patient population. They may have to come in for a few infusions of ketamine, but we've really found great success with that. And we've actually started publishing it and are presenting it in our national meetings, which has been exciting.
It's amazing. And Akron Children's is such a gem right here that we have these techniques, people like you to help us and our kiddos. How do we know when our kid needs that help, when it gets to a chronic level of pain and we really need to address it on a more serious level?
Great question. If pain persists and we see our primary care providers and they refer to certain specialists, eventually patients, we're fortunate enough that we've got a wonderful reputation and we've been in the community for so many years, but eventually patients may find us through referrals, but patients can also contact us directly within the Department of Anesthesiology and Pain Medicine at Akron Children's Hospital. We're also on the website, so we try to be as accessible to our patient population as possible. Once we get inbound from a patient and family, then we'll typically set up an initial consult and talk about what the concerns are, what type of pain we're managing. Is it acute? Is it chronic? Is it the in-between transitional? What kind of services can we offer, like the ketamine infusions I mentioned? Or we also do interventional procedures. So an example of an interventional procedure is something called cryoablation. We're actually the first center in the state to offer cryoablation for the pediatric population, and I think perhaps the second in the country. So it's really innovative, and we're freezing nerves that are superficial nerves for sensory. So somebody may have knee pain, and that's a sensation that the patient is feeling. And so we provide very light sedation and use this equipment to essentially freeze the nerves, which helps to reduce pain that patients may experience. So the fact that we're using techniques like cryoablation for our adolescents and our teenagers has been hugely wonderful for our community, for our patient population.
Oh my gosh, it's just fantastic. So for parents and caregivers listening right now, what ages do some of these pain management techniques start at?
Great question. We, of course, will take any adolescent, any teenager, any pediatric patient, because that's what we specialize in. I'd say most commonly age 8 to 18 up to 26. We typically will go up to 26 from our perspective. We'll see patients with a wide range of complex or chronic type of pain issues or problems. So we are very comfortable taking care of a wide range of patient populations.
Is there anything else that parents need to know before we let them go real quick?
I think the main thing is to know the experts that you're talking with and the experience that they've had, making sure that we're really utilizing evidence-based protocols, even with innovative techniques, and to really consider Akron Children's as leading the way in pediatric pain technology and innovative techniques.
Thank you so much, Dr. Bala, for your time. And for more information for everyone at home, just go to akronchildrens.org.